Vermont Policy Drafting Committee. I think it's probably prudent if we go around the room and identify who we are. If we wouldn't mind introducing ourselves.
Jim Culkeen, Superintendent, SVSU.
Frank Barnes, Director of Educational Technology, SVSU.
Dick Branch, Woodford.
Jackie Kelly, Bennington School Board.
Bruce Clark from the CDC.
Angie Rowland, Final. Sandy Bennington, Principal, Woodford.
Bruce Fairman, North Bennington Grading School District.
Dave Barrow, High School.
Lisa Poplack, Health Assistant, SVSU.
Holly Van Chassberry.
Jim O'Connor, Powell School Board.
Kaylee Stump. I have kids in Pownell School, and I'm from Pownell.
Laura Hamilton, I have grandkids in Pownell School and Bennington Schools and high school.
Nancy Coleman, School Nurse at Mount Anthony Middle School.
Kathleen Lacasse, School Nurse at Bennington Elementary School.
Derek Carson, Bennington Veteran.
Thank you. Our agenda this evening will start with public comment. We'll launch into number 5140, which is communicable diseases. Consider 7300 public participation in board meetings, and finish with 6350 grade advancement, retention, promotion, and acceleration of students. I know there are some folks that need to get on to other meetings in other places, so those that are here for public comment, is that in relation to communicable disease?
Head lice.
That would be under that policy. Are there any other public comments? Let's get into 5140. You have read the policy.
I have.
What we do when we construct these policies is do a little research in other school districts, municipalities if it's appropriate, state governments, health agencies, et cetera, and all those things go into constructing a policy. And so this is how we came up with what we came up with. Are there comments you'd like to make?
Yes, I actually had a little bit of my own research. Would you mind if I handed it out?
In case you don't have enough.
Okay, yeah.
So I've done a little bit of my own research about head lice. I've dealt with this in the past with my children at a personal level with the issue, and I know it's not easy to get rid of. It's very expensive, very time consuming. I don't think right now with the current policy that there's really any control measures. It's just kind of give or take. It's up to the parents whether they want to or don't want to treat it. And I think that if we keep it with no control measures at all, we're going to run into a lot more kids getting it. I know that it's not a disease-carrying parasite. However, the research that I did, the CDC actually recommends that they be sent home early from school. It's all in this pamphlet and where I got it from. The Vermont Department of Health says that they should return only after the first treatment. What I'm proposing is not to send the children home early. What I'm proposing is that the children be let out at the end of the school day, and the parents are to treat their children's head that night, and they can come back to school the following day as long as they have been treated and there are no live bugs. I don't agree with the no-nip policy either, but I just feel like, I mean, my youngest daughter's in kindergarten, and I was told by her teacher that there's 2 cases in her classroom. And I just don't, I mean, I was told this probably 2 or 3 weeks after school had started, and they had been there since the beginning of the year. I just don't agree that there's no control measures at all. Head lice bites can lead to secondary infections, they can, I mean, they're just,
Toxic chemicals that
yeah,
treated
and
over and over.
when you're constantly, when your kid's constantly coming home with head lice, and you're constantly treating their heads with the treatment, the ones that are doing it, the chemical is by far not good for their heads to constantly be treating them.
And then you've got things from other schools.
I also have some, in this packet, I have from other school districts, I didn't do all of them, I just did a few, from the state of Vermont, other school districts' policies, and none of them are like ours. I also started a petition myself in here. I've gotten almost 100 signatures, and that's just on Facebook alone. I didn't put any signed ones out, I didn't go anywhere else on the internet. I just literally went through my friends on Facebook, which I don't have that many. And there's numerous comments of what the community is actually saying about this new policy. Any questions for me?
Have other comments? I'd like to add?
Did you want to add?
I just don't think, I don't agree also that the child should be sent home on that day, but they should be treated. And I don't really think it should be up to the schools to make the parents treat the children. But if that's the only way it's gonna get done, so that they don't come back and keep, reinfesting other kids, then, it is the responsibility of the schools to keep the kids, safe. And these bug bites from scratching can lead to secondary infections. They don't fly, they don't jump, but they can travel 9 inches in 1 minute. So if you've got kids that are head to head for more than 20 seconds, they can very easily crawl, as they crawl fast, from one child to the next. Plus, when you get into the hat and coat season, they can live on the hats up to 24 hours. All the hats are put in the same place in the school. It's you're gonna start having more and more and more cases.
I'd like to add as well, my oldest daughter actually has anxiety. She's in the 3rd grade in Pownell. She was just recently diagnosed with this, and she's been through it. When she was 4 years old, we went through it, and it was a horrible, horrible experience for her. She has very thick hair, and to sit and get her hair pulled and combed through. And now, of course, she sees what I'm doing, and, the anxiety's already arisen with her, where she's afraid she's gonna get head lice in school. And how do you tell your child that I know everybody's supposed to get along and sit together and share and whatever and whatnot, but when you have my 8-year-old in school watching someone itching their head, she's worrying that they have head lice, she might want to move away from them. And that's going to put a burden on the other child as well, because then the other child's like, well, why doesn't she like me? When it's not the case that she doesn't like her, it's just she's afraid to get head lice.
Jim? Comments?
Just that I support Caitlin. I think she's doing a good job on this. I don't want head lice.
We do have 2 school nurses present. Would you like to address that issue in any phase?
Well, I hear what you're saying, and head lice is a very emotional issue. It is anxiety producing. I have 2 adult children. When they were in school, they both got head lice. It's unfortunately one of those things that humans have to deal with. And, I'm a nurse, and I'm a school nurse, and have done a lot of research, been to a lot of talks on head lice. And across the country, they are no longer excluding kids for head lice. I work at the middle school, I have not been excluding kids probably for about 8 years now, since Dave Adams was principal. And we've had no huge outbreak of head lice. One poor girl that several years ago had head lice just about every day of the entire school year. If we excluded her, we would deny her education. And she, as far as I know, never gave it to anybody in school. I was on the phone with her mom a lot. We were discussing different treatment options, and nothing seemed to work on this poor girl. There is evidence that some of the lice are resistant to the treatment itself. So, you know, how do you get rid of it if there's no treatment for it? One of the things that I've heard through the grapevine that has worked for kids that I've told the parents they have head lice is olive oil. And that's not a pesticide, it's not a chemical that could be dangerous. Olive oil had worked very well on kids. But I do, since this is something that is going across the country, I feel that if we were to exclude kids in the supervisory union for head lice now, we could be liable for denying them an education. And education, as we all know, is very important, and we want kids in school.
I work in the elementary school, and 2 years ago I had a child in a similar situation, and she was absent 47 days from school for head lice under our policy. And I don't send them home for nits. I never have. But I did send them home for lice, 47 days. And then I stopped sending her home, because she was never going to be able to move along in her education. I never found that I combed her hair every day, because I knew that she was not going to be treated. And every day, I got out 20 to 30 live lice. Never had a problem with other children in her class. She was instructed, keep your head away from other children. She was always had her hair in a ponytail. She left my office with her hair in a braid or a ponytail. And that's how I treat all the children with head lice. I instruct them how they transport themselves. They cannot fly, they cannot jump, they walk. You need to keep your head away from every other child. And when you're lice-free, you need to keep your head away from every other child. What does that mean? That means no hugging. That means no studying with your heads together. That means no sharing hats. Although hats, obviously, they really don't transport that many lice. It's been proven not. But it's still a thing with parents, so it makes sense.
What school did you say you were at?
Bennington Elementary.
Bennington Elementary. It's not so much the older kids in the high school, you know, it's the little ones, really. I mean, my kindergartner, they're constantly hugging, they're constantly next to each other, you know, and I've instructed my children to stay away. But another huge issue, which actually, if I can't change this policy, I will be speaking with the school about individual cubbies for every classroom. Because I don't agree with, you can get head lice. They can live for 24, 36, 48 hours live without a head. And I know, not in my kindergarten and first grade in Pownell anyways, has their own, each individual own cubbies. Once you hit second grade, it's one big cubby box that all the stuff gets thrown in. And I won't agree with my children putting their stuff next to other kids knowingly that they have head lice. I will not.
Can I answer that about lice on objects? There is a guy who, I don't know how he did this, but he studies head lice. His name is Richard Pollock. And I've heard him talk a few times. And he said if lice are falling out of the hair or have, gotten on somebody's coat or clothing, they are dead or dying. They are not able to reproduce. So it's virtually impossible to get head lice from coats sitting next to one another. They're parasites, they need a host to survive, and so they need the head. And what I read up a little more today on it, and I was surprised because they said even the nits are not viable if they're more than 1 centimeter away from the scalp. And 1 centimeter, I forget what 1 centimeter is, and that's less than ½ an inch away from the scalp. So the literature that I've read on it said that really it's very unlikely kids are getting head lice from schools, that it's mainly sleepovers. It's those close contact. And the best way for people to kind of rein in head lice is to get the message out there that parents need to check their kid's head at least weekly for head lice. And that would help cut down on the incidence. I don't think we'll ever eliminate head lice completely.
Absolutely not, and that's not what I'm trying to do. But if you read the new policy, there's absolutely no control measures at all taken, none whatsoever. And that's what I don't agree with. I'm not saying send every child home because you see a nit in their hair. No, I'm not, absolutely not. I don't agree with it either. I work in a pediatrician's office, I see it every day. But I don't think that my child should have to go to school with anxiety levels this high, worrying, because she knows there's no control measures at this point. I mean, she was there at open house when I talked with my youngest teacher, she sees all this. And that's not fair to her. Having to sit there and worry about the person scratching their head next to them when she ultimately isn't getting the education she needs either. So if you look at it.
I'm not understanding, what is it the control pieces that you feel should be added?
There's 2 cases in the kindergarten class that are so bad, you can literally see them crawling from feet away.
But what is it that you want how you want the policy to be? What would-
To be bug free, not nit free, because
But I don't
most
think
nits
they
that
should send
are
them home
seen,
either.
most nits that are seen are either empty eggs that have already hatched, or like you said, if they're more than 1 centimeter away, or something like a 1/4 inch away from the scalp, since they have to feed as soon as they're hatched to survive. If they're more than 1 centimeter away from the scalp, they're either probably a dead egg that will not ever hatch, or it's a shell that's already been hatched.
But I'm still not understanding,
So,
you want
I-
the school to demand that the parent treat?
Well,
Be checked before they're allowed back in.
so
for
the school
actual
is
bug.
not actually denying them education. If the parents do what they're supposed to do at that night, there's also, that says that it should kill, it's really high, that it should kill all the head lice, the live.
Let me just
bugs.
stop you for a moment, and maybe I could explain what we do in the elementary school.
Well,
So if I find, go ahead.
well, I know what's supposed to be done, but I talked with my school nurse on the phone, and she basically was like, we call the parents and tell them that they need to treat the child's head if they have head lice, and that's it. That's all they do. They don't even do routine head checks, even though that's written in the policy.
Okay. I'm gonna speak for the practice I've been now, and the practice that we are expecting will be this policy. And that's not to send the child home, let's say I see somebody this morning at 10 o'clock who's scratching, and it's sent to me by the staff because the kid is scratching. I look and I find lice. Put the kid's hair back in a foot, let's talk about a girl. Put the kid's hair back in a ponytail, explain how lice act, what she's responsible for doing, keep your head away from your other classmates. I'm gonna call your mom and dad and let them know that you have lice, which I do. And then I speak to the parents and say, you have to treat her hair tonight. Send her back tomorrow and I'll check her in the morning. They come to me first thing in the morning, I check again, and let's say I found one more live lice. I still don't send them home. I call the parents again, say, keep combing, keep combing. If it's one lice that I find, I might comb the child's hair if I have the time and not 5 other little children waiting. But I don't send that child home. I call the parents again, write a note, keep trying, don't treat again, keep combing. So it's not like there's nothing, but I can't make that parent do anything.
No, you can't. But before, it was like the child, I don't know, it makes sense to me. It makes sense to me as a parent. Like I said, I work in a pediatrician's office. It makes sense to me, and I do understand that there is cases where they can't get rid of them, period. That case, maybe there should be acceptances to the policy in that case, because they're not transmitting them. But they can't get rid of them. They're gonna have them for the rest of their lives. They would, but for children, I mean,
That come back to
most
school and the
parents-
parents have been notified and their hair hasn't even been washed, never mind treated.
exactly.
Day
And
after
they're,
day
and they
after
get to
day
go
after
back
day.
into the classroom.
Those are the things that
This is what
we
I'm
need to
talking about.
prevent.
That we need to have some sort of, I don't know if it needs to be more patient education for the parents, I don't know. Maybe stuff, there's also people that can't afford it. And people, you have that upper poverty where they don't get state assistance. This is the category that I fall into. I can't get state assistance. So therefore, if my insurance may or may not cover it, I have to pay for it over the counter, not once, but twice, not for one person, but for 4 people. That's what my household is. It gets very expensive, and I don't think that I should have to, it just, for those, and especially for the people that can't afford it, maybe there should be something in place where the school can pay or help pay for these parents to treat their children. Because I know there's all different kinds of people out there. There's ones that refuse to treat their children, absolutely refuse to treat their children. They just won't. They just don't, and they won't. There's people that try, like you said, they try as hard as they can and they just can't. And then there's people that can't afford. You know, but you have to hit each person. You can't just say, okay, well, there's no control. We can do what we can do here, but you're missing all those other people. If that makes any sense.
Okay.
In the handout that you gave us on page 22, it says, other ways to prevent lice from returning. Perhaps a sentence or two in this document about a handout to parents, about the household and how to treat the household would be good.
Actually, that is not recommended any longer, because of what I said, that head lice are not viable off the host. So you really don't have, are you talking about household items, or are you talking about the people of the house? I'm
Both.
sorry, I just realized that.
Both of them.
And the other thing is, they strongly recommend that you don't treat everyone in the household, only those with head lice, especially if you're using pesticides, because they are pesticides. And you want to minimize any danger to the host.
I might interrupt. I understand this is an emotional issue. Policies, we change policies all the time depending on the circumstances. So we're going to take your comments under advisement even though we're not done with that issue yet. I just want to reassure you that when we put policies together, the research I did on this came from Virginia, Ohio, Chittenden, California, Manchester, New Hampshire, Maine, Franklin, Massachusetts, and New York City. So we don't put out stuff without doing what we think is decent background research on it. And what I found is the common denominator in all of these things, with one exception, Franklin, Mass. does have a no-net policy, but once a child is identified as having active infestation, there's little reason to immediately send a child home. Again, they're talking about waiting to the end of the school day, send a child home with instruction to the parents, and check them again when they return the next day, as Kathleen was talking about. I don't want to blunt your suggestions, and we always take these things under advisement and change things as much as necessary to accommodate things, but we certainly have to consider the education component at the same time. And there are some serious issues about sending a kid home that doesn't get treated, whether the family wants it or not, and I'm not sure the school system can enforce that. So that's another discussion that has to be had with folks that have a whole lot more authority than I do. But
Which I agree with, but like I had said, there's certain people that are being left out of the equation here. The people that can't afford it, you know what I mean? If I can't afford it and I come to the school and say, hey, I can't afford it, I absolutely cannot afford it. Is there any way that you can supply me with the stuff? I want to treat my child.
I'm sure we can consider that.
I mean,
as we
there's
discuss
just
this.
other,
There's a
I
lot
feel
of
like there's
parents
more
that don't
control
know how to
measures
treat
without
as well.
saying,
So if there was something that was sent home with them to tell them how to treat, you know, like what to wash in their household, that you have to treat and then retreat in 7 to 9 days, you know, things like that, that they need to, that they should tell them.
I also spoke with my children's pediatrician on this, and he said that any patient education that he can help with, he's willing to help. You know, he's willing to put things together, send things out, you know. I don't know, I'm coming to you with a proposal, but of course, talking amongst other things, I don't know what the solution may be, but I just don't think that it should be, just call the parent, say, hey, you have head lice, okay, have a nice day, and then
Well, I
life
think
goes
that's-
on.
I think that you're minimizing the amount of conversation that goes on in that telephone conversation.
Well, right, but ultimately,
Ultimately, we spend a lot of
And-
time with the parents explaining what they could do, what they've tried.
right, but then they get home and they've forgotten what you said because they were at work when you called and they were doing 5 other things. A piece of paper
Hang on a second.
may reassure.
You have some-
I was just going to, see if I understand you correctly, I think what you were asking for actually might be in this proposed policy, which includes information about head lice sent to the parents. So it actually is in this proposal of this policy that was sent out. And the other piece, on the very first bullet, the school nurse or designee will determine, if necessary, if there's an issue that needs to go further. So both of those pieces that you brought up that were very important actually are in this proposed policy.
Frank?
Yeah, pardon me, I'm seeing, I think, what you're referring to, Sandy. And it's not clear that it should be in writing, and if putting it in writing, I mean, I think that's something that's easy enough for us to change. It says they need to be informed, and they need to be, you know, told about, it doesn't say how, but if we put it in the policy that they get a written notice, is that, and that's going in the right direction, I would think at least. I don't know if it gets to where you folks would like to see it land, but if they get a written notice saying how to treat and where they can get help if they need help to treat or something like that.
Well, I think that that's a piece of it, and, you know, if what, I'm sorry, I forgot your name.
Kathleen?
If what Kathleen is stating, that, you know, the child comes in and she pulls the hair back, she instructs the child what to do, she calls home, the parent is instructed what to do, and she rechecks them in the mornings, you know, then, and she's repeatedly calling the parent saying, you need to do this, you keep, you know, basically getting on their case almost, so to speak. That would even be more than
What's being
from
done.
what I
Your
understand
child's class.
is being done. And I'm not saying in your school, I'm not saying in the whole SVSU. I know what's being done in my school. I spoke with the nurse myself, and that doesn't seem like, you know, I talked with the teacher and the nurse, and that, from what I understand, is not what's being done. It's just, you get a, you know, they call the parents, they inform them, they tell them what to do, and that's like kind of the end of it. And it's like these children, I mean, when you have a teacher telling me that the child is coming into school, and, I mean, an infestation, and there's, how could these parents have been informed of what to do? How could, I mean, if,
Well, once again, we can inform them, we can give them paperwork, we can encourage them, we cannot make them.
and I'm not saying, I know, like I said, I work in a pediatrician's office, we get calls all the time, and it is kind of annoying when it's constant, and it's like, well, what do we need to do? Well, I already told you, you have to just do what you're supposed to do, and you will get rid of them. Like I know what I deal with it too on a different level, I deal with it, you know? But I'm not saying make these parents, you know, go to their house and do it. And I would like to add, which just made me think of it, I actually spoke with one of the doctors, Dr. Childsey, that in the practice that I work for, about he had said he had went to some bigger cities as well. And she was telling me today that the bigger cities actually will have, some of them have personnel that goes into the school and will actually help deal with this child with this head lice if it's an ongoing repeated issue that needs to be. She said that she also tries to get VNA in these houses to help these children get rid of it. You know, there's more that that can be done. I don't know, there's a lot more resources out there. I don't know if they don't know, if maybe you don't know, you know what I'm saying? It's just, not saying you, so to speak, just anyone in general. There's more that can be done about this.
I think we've reached the point where we're off topic, because the persons that you're referring to now are like social workers. And what the school can do is not what the social worker can do, what the
Well, no, I'm
Department
not
of Health
saying
can
that.
do.
But as a nurse, they can help get those services into the house.
I'm sure they do. I'm sure they do, but I guess the policy is not addressing social workers, not addressing the Department of Health. It's addressing what the school does.
Right, but what I'm saying is what the school either,
The school can't reach out and be everything to everyone. You know, they have their responsibility, and the responsibility is the education of students. And so if you take that child out for a length of time, that child's not being educated. Your point was, of course, in bringing this up, is that the other children, for fear, are not being educated also. So there has to be some type of, some type of
my daughter
distance,
being one of them.
probably, that one child has against another child, and that can happen in a classroom. But as far as going out and paying for this and paying for that, we can't do that as a school. We're responsible for education.
There's actually, I believe, I left my other research at home, there's, the state of Vermont gives money to the school for health-related issues. It's grants, it's done every year, I know this. So,
Well, you're still asking us to become the social worker. for
I'm
the
not
neighborhood.
asking to become a social worker, I'm asking that my children get the education that everybody else is allowed.
And
My
distance-
daughter
in
is
this
at a
case-
high level
In
of
this case,
anxiety.
distance will enable that education. When, we've all heard what happens, okay? So if you're sitting, if I'm not sitting next to him, and if I tell him he can't have my cap, okay, then we're fine with this. Or if your daughter wants to sit here, she can sit here to lessen her anxiety. But to take a child out of the classroom who doesn't need to be out of the classroom is not right either.
Right, but my daughter's not getting the education that she needs to either because her anxiety level's so high. I don't know if you have ever dealt with a personal level of anxiety, but I sure do. I know what it's like. And when she's sitting at a desk worrying about head lice issues, rather than being able to concentrate on her work, you're basically denying education to my child as well, because it's not fair that she needs to sit there.
But you need to inform her that this can only happen.
She's already on all kinds of meds. I deal with her doctor about this anxiety. It's not something that you can just tell your child to get rid of the anxiety and she just does it.
Can I just caution that this is being recorded, so we might want to, I don't want to cause anybody embarrassment or anything like that, so I think just remember that this will be broadcast, so as we talk about specific medical issues, we might want to be a little bit more careful.
I'd like to point out too, I think you have some really valid points, and I think personally, as a member of the policy committee, I think we should look at them and address them and come up with some ideas. But this addresses one of the other policies that we're gonna be talking about tonight is citizens' comments. Right now, we could be actually working on the policy, but we're spending half an hour talking about it to death, in a sense. And I don't mean that with any disrespect at all. It is really tricky in education where our lines are drawn between the school and the house and what our responsibilities are. And we take care of kids as much as we possibly can. I think it's a good idea to have something more substantial. You made a great point about, when the parent gets the call, they might be in work, they're doing other things, it goes away. Also issues with, being able to afford it. But we also need to have the time to address it in the meeting. And often our meetings get derailed, so to speak, because we spend so much time on what's, how long we spend on citizens' comments. And just, so I would suggest that we, wrap this up, that I'm taking what you're saying very seriously myself, and I'm sure others here at the table are as well, and let us discuss it and see if we can come up with a plan. It's not warned yet, is it?
Yes, I believe it's been warned, but that still allows for a comment period, and what we can very easily do is take some of these suggestions, continue to talk about them, get together with professionals and find out how we work things into a policy or administrative regs in this case that makes sense.
Let me at least make one correction. We're not talking about a policy. We're talking about administrative regs. Policies are what boards make. So it could be warned, it can be, the regulations can be changed. This is a section called administrative regulations. This is for public, so everybody understands. The regulations can be changed at any time without board approval. It's not about boards approving that. Regulations can be changed when administration thinks that regulations can be changed, need to be changed. There could be additions made to this to make it clearer as to, for example, what information goes home. There could be information, or this particular regulation about head lice, which was changed, but the policy itself, which ends with the little boxes, that was never changed. So just so that everybody, the lawyer in me just says, let's keep our language clear. Policies are what boards do. You're asking for a change in regulation, which I am sympathetic with as well. I think there is a way to take what you have said under advisement, make some changes, and the administration could make those changes before we meet again. That would certainly be possible, but I would want to do that with input from the people who actually put the administrative regulations in place in the first place, and that is the nursing staff, and have that conversation and to see with the administration and see if we can make some headway in that area. So whether it's warned or not doesn't really matter. It's irrelevant. These changes that you're asking for could be made at any time by an administrator. Okay.
Bruce, just for clarification,
Uh-huh.
I'm not sure what you mean by administrator, because are you saying then that Pownell's administration can have a different administrative reg than,
No,
Superintendent.
no, this is out of the superintendent's office.
okay.
So the Pownell administrative regulations wouldn't be different. No, we're still working under, unless, and you can correct me, Jim, if I'm wrong, but I'm working under the assumption that we're trying to keep a unified
It is.
supervisory union set of regulations. I think a lot of what you have said, it sounds very specific to Pownell, but I also think it relates to the way in which, how should I put this? The way in which things have a different flavor in different places. And I would hope that some of this conversation would in fact go back through to Pownell and be discussed among the nursing staff so that they're all of one mind about this, and there's one process. And there may be things that I suspect, Nancy, you might be able to would be useful to have in this. Maybe there is a brochure about, here's handy information about how to clean heads and what to use, and here's what you need to worry about, and here's what you don't need to worry about. And yes, I would like to see your child tomorrow morning before she goes into or he goes into class, et cetera, et cetera. And that would seem to me to resolve essentially the issues that are here. But I don't think it needs a policy change at all. In fact, I know it doesn't need a policy change. You're asking for regulatory change. You may not know that, but that's what you're asking for. And that's perfectly okay. I think
What would be the difference? I'm not,
the difference is that policies are made by school boards. And regulations, excuse me,
Yeah.
just let me finish this. And regulations are made by administrators in an attempt to put teeth or to put application to the policy. So the policy is really, if you look at it, for example, the policy that I think that is appropriate is, the statement is at number 1 of the actual policy, the school nurse or designee in consultation with administration as needed will determine when a student or employee shall be excluded from school due to a communicable illness. And when appropriate, blah, 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 blah. That's the policy statement. That I don't think you're asking for that to be changed, as I hear you. What you're asking to be changed is the way in which that gets applied in the area of head lice,
well, I
which
think
is in
I'm-
regulations.
I think I'm asking for the policy to be changed.
It's actually a matter of language, as we were saying here.
What goes home in the
policy,
handbook?
the policy is, well, the regulations,
The-
what goes home in the handbook is the policy plus the regulations. The regulations determine how the policy is implemented. So the regulations that we're directly addressing are the regulations on head lice.
Right.
So we can change, or Mr. Culkeen can change, he would be the administrator that could change this, that regulation, and it would become part of the regulations of that policy.
And it would regulate every single employee in the school districts in the SVSU, and it would in fact, that would be what would go home in the student handbooks. So what you're asking for is a change of what's going home in the student handbooks, as well
And-
as the actual practice. And it is a regulatory change. The difference is, if you're asking for a policy change, policies require the consent of all school boards in the SVSU. And that's a much longer process than what I'm thinking you're asking for. And actually, the language which you're talking about is the language about head lice, which is in the regulation section, which means, in fact, that's good news for you.
Right.
It's easier. Does that make some sense?
I think we'll clarify that so that maybe we can all convene a meeting together to discuss the concerns of that level now that we
Know where we
determine
need to
it's
be.
not a policy issue, but
No.
so I'll be glad to be in touch with you and we can have a meeting and I'll solicit input from the school nurses and we'll see what we can do.
Okay.
The policy empowers those people within the school or the administration address certain issues, how they're going to be addressed is what Jim's talking
Yeah,
about.
just
So
made a note to myself, emailed it to me, so that we'll be, someone's
we
gonna
have
be in
heard
touch
your
with me.
concerns.
All right.
Are there other comments from this committee about that?
I must make one more.
Kathleen?
I congratulate you all on not scratching at all.
If we all, like you.
That's right.
That's right.
Do away with this problem altogether.
Some parents have done that, even to their little girls.
That's right.
Yeah.
Yes, they
It's
have.
happened.
Well, then we should move on to our two other policies for discussion. 7300, public participation in board meetings.
That is a policy.
And if I'm not mistaken, Bruce or Bennington had some concerns about this particular policy that.
Yes, you'll have to put it in concern, okay?
Lisa.
This is just getting your contact information.
Oh, you're okay with it too? Yeah. You wanna throw it past you? You got enough there?
Do we have
Just getting
Oh.
your contact information for me.
a, okay, that's all right. No,
Back
I-
on track and just.
that's okay. I can take it.
No, you good?
Thank you.
Are we set to continue?
Yes.
Okay. Public participation. We know North Bennington has tabled this, I think, a couple of times, but we don't really know what their concerns are.
Okay, and I'm sorry, we'll have to scroll down again. I wasn't able to retrieve this before the meeting.
Okay. Where do you want me to go?
That's what I'm looking for.
Lisa did send me North Bennington minutes.
You want, will that be easier?
Thank you, that's probably much easier for me, yes.
The shades
Never
are
put
gone.
the shades up.
Open meeting law.
Yeah, can't see the board. Thank goodness.
The questions that the board had to do with the various protocols that were referenced here but not included, and we had no way to check on the status of those, the communication protocol, protocol for public complaints about personnel, I believe was another one.
That's not a protocol, that's a policy, and that's actually in your policy book. That's, you're right about the communications protocols, that's been an open question. But the policy about public complaints about personnel is number 1025. And all that says is you gotta make complaints in private.
Right.
Yes.
It's a separate policy.
It's a separate policy. It's in the policy book.
And
So I believe it was the fact that there was no, that the communications protocol was not included or reviewable in terms of this, the effect of this policy.
as in correspondence to the board,
It's actually referenced.
because that is referenced in 71.
No, it's a different, it's a-
No, line number 75, it says communication protocol, place here. Are there any,
Oh,
but there is no
Right.
protocol provided. and in line 77 as well. We don't know what those protocols are, and therefore, we didn't feel that the policy as submitted was complete so that we could evaluate it and pass on.
Those would be administrative procedures rather than part of the policy.
Mhm.
They shouldn't be, those lines shouldn't be in here at all.
Right.
No.
Okay.
Bruce, if it's helpful.
Can you give me reference to those
I-
as administrative regulations or procedures so that we could review them
Sure.
when we review the policy?
I'm not sure I could because I was never given them
I'm not
either.
sorry, I'm
Yes,
not-
I know,
I'm not
I know, I know.
directing to you.
But I can give you at least some reference to what it was I was told we were talking about. And that is, apparently the superintendent at the time had distributed to board members, suggestions about what do you do when you get somebody coming up to you at the dump, or, you know, you have this, so it's that kind of conversation, you know, that you remember that you are just a member of the board, you can't speak for the board, you're not, you know, it's that kind of stuff. However, I've never seen it, and when I drafted or redrafted this, asked for it at the time, or said maybe it's convenient to have it there. The language in 75 and line 75 and line 76 is mine. That's why I'll be happy to, because I had asked the question, where is it? And if so, we could put it there as a kind of administrative reg, or not. And we could just eliminate that to sort of eliminate the question.
Well, I think if we did that I think that would be, in terms of the sense of the policy, I don't think that would make much difference, but I think the reference to it would have to be removed as well.
I agree.
So then I don't think there would be any problem. As I say, we tabled it because it didn't seem to us that the policy as submitted was complete.
Sure.
So are you talking about eliminating 70 through 77?
Yes, and I'm looking for the reference to those, I guess that's in
Line,
line
it's
50.
line 50.
Yes.
50. Oh, because it's
Yeah, see
down
that?
the bottom too.
Yeah, line 50.
And,
Because it doesn't change anything in the policy.
well,
No, it
yes, line 49 is gonna be a problem as well. You know, I don't think we can just tell individuals with such
Oh, I see what
concerns
you
to
mean.
follow communication protocol and policy unless we can give them a reference to it.
Yeah, I hear you. You could,
But can you refer them to 7192?
7192. If that's the reference we want to use there, that's fine with me. I'm only saying that right now,
Mhm.
it's obscure as to where one would look for the procedure to do that.
right.
If we wanted to cite 7192 in place, if it adequately addresses that, I think that would be fine.
Bruce, would it also be helpful to just strike the words communication protocols and in line 49?
If policy 7192 is going to be the reference for that,
Along with 1025.
and 1025,
I think that
then I
would
think
be,
that would be fine.
I think that's in essence what they are.
Right.
So that if you have, I think
Yeah,
that's,
I can't envision anything that would be covered
right.
under comments or concerns that you
Right.
couldn't address through one of those two policies.
I would
So
agree with you.
That's fine.
I think, so does that make sense? Do we want to do that, Mr. Chair?
I don't know why that doesn't make sense. And correspondence policy 7192 really narrows it down to
Mhm.
written correspondence.
Right,
Right.
And not word of mouth
Mhm.
discussions.
Right.
right. And if at a later time, the boards want to have some uniform way of dealing with communications outside of board meetings, you can do that as much as you want, but I don't see why you'd want to reference that in any kind of policy thing.
Right.
So does Lisa know what she's got to change?
Okay, so
Seems
here,
Hang on a minute. Laura.
seems to me you'd be.
am I taking
Right.
all this
No,
out?
it's just the words communication protocols and
Right.
is what you're getting
Okay.
rid of.
with such concerns to follow policy.
Yeah.
And then this yellow section would
Um,
remain or go?
No, that's.
no, I think you delete that too.
That's what I was thinking.
Yeah.
And then everything at the bottom.
Right.
Yeah,
The cross references are in there, so I think.
the
that's
cross
fine.
references are already
Yeah,
up above,
Yeah, so
Yep.
lines,
whatever that is.
So do you need to
Okay.
say follow policy below or something? Just
No,
below,
because you
just
know
follow
what you've
policy?
got, follow policy, and I would say, then you've got the cross references are right below it, it's easy.
I agree.
Right.
Lori?
The challenge that we keep having as a public participant at board meetings is that the policy or procedure, administrative regs, differs from board to board. The other challenge is that I have been sent to the boards to have conversations, who then kick me back to the policy committee to have these conversations. And neither one of them want to have these conversations. So when I have a concern, I still have no direction as to whom or whom, yeah, like who or whom
Yeah.
I'm supposed to bring them to. And that's where our communication flow chart, our communication,
Protocol, yeah.
sort of whatever, suffers. We really don't, I mean, I've had, here's a person bringing information to a policy committee because that's what she was told to do. That's what all the boards say to do. Whenever a policy is warned, bring it to the committee, and yet the person doesn't feel like she's being heard, but then again, she's under time constraint to speak. And I get that everyone has a job to do, but I'm just still, again, who is it that parents or the public is supposed to bring these concerns to if no one really wants to spend time discussing them or to hear them?
Didn't we have this conversation last time?
Well, we seem to have it repeatedly because there's
And-
still
and
no
the-
real explanation or no real guidance on it because
Yes, it
nobody
was.
is assuming responsibility.
Well,
Chain of command, and that's
it was
what-
the chain of command, we discussed that last time. We discussed the chain of command,
Right.
we discussed the fact that written communication is probably better because everybody then can have a copy, just like this lady brought.
Mhm.
And it keeps you on topic, so that you don't stray away, and the rest of us don't stray away and not hearing you. And those are the types of communication that are best brought to us.
Okay, I get that, but yet I've received direction from the board to say, don't bring it here to the open meeting, let's talk about it. Bring your concerns to me and I'll bring them to the board, or I'll bring them forward. So, again, the miscommunication is still out there. I'm still, and I get that I'm taking up more of the policy committee time, speaking of this issue, but it's because I continuously get conflicting information.
So who do you have a problem with?
I have a problem with all the boards and all the committees that don't want to hear from the
So you go to all the
public.
boards?
I go to the SVSU board, I go to the MAU board, I go to the Bennington School Board meetings, I go to
So-
policy and personnel committee meetings.
Yes, but what's
So-
the problem?
The problem is that when I bring a concern.
No.
Okay, so you just already, you
No,
didn't
no,
wanna
no,
let me
But let's-
finish.
Please.
Please.
Let's calm this down. May I ask it in a different way?
Sure.
What is it you would like to see in this policy that empowers you to do what you need to do?
It's just,
I'm
I would
missing
like
that.
it because I bring it to the board and the board kicks it out of the board meeting and sends me somewhere else. And then I bring it somewhere else and they say, we're not gonna talk about this here. So I guess clear guidelines as to if the board requires written communication to discuss an issue, which at this time is not required by the VBSA, or the VSBA, excuse me, I would like to know that. Because as far as the guidance comes down from the state, it doesn't reflect that it has to be. It actually encourages the boards to speak to the residents. However, I find that, because I am an active parent, I do consider education to be the most beneficial thing we can provide our children. But yet, if I bring an issue to someone's attention, I feel like, okay, well, we're a board, we elected other people to do that job, or we put in place other people to do that job, and then there's no real guidance as to who to bring it to. We're told to bring it on a policy. We're told to bring it to the policy committee. But then the policy committee says, well, we have to get a job done, thanks very much, we're out of time, let's go. So who does a parent bring their concerns to? If we follow the hierarchy that's already out there and they follow that to the superintendent level and they have nowhere else to go with it, I understand from you that you said, Jackie, that they're to take it to the state and not the school board.
Well, no, we went over this the last time, this is why I'm saying, what is the problem? Because we said, first you take it to the teacher, then you take it to the principal, then after that is exhausted, then you take it to the superintendent's office. And then someplace along that line, we define the problem. And when the problem is defined, then you can speak onto that problem.
Followed varies with every board chair. But if it was followed strictly, my understanding would be the public can only speak in the public comment period, right? Unless the board recognizes something. It's not a public meeting. It's a meeting held in public. That's, I guess, the difference. It's a meeting held in public of the board. It's not a public meeting, which means the public is not part of the debate.
Right.
But there's an opportunity for them to make comments in the beginning of the meeting. So if I'm hearing correctly, one of your objections is that if they bring up a topic that was not on the agenda, you really didn't have an opportunity to address it because the public comment period is in the beginning and something else might come up and now you didn't have that opportunity to speak for before. Is that?
That could be one of the things because
But is
it is one of the
Okay.
issues, definitely. And also just to provide some more input, I'm not sure that it's necessarily stated in stone that the public comment has to be at the beginning of the meeting. I believe the direction that came down was at that time, or you could do it at I have gone and purposely asked, do you want me to comment now or wait till we get to the agenda item? Because it differs depending upon what board you're working with. So
Well, I
some
think
would like
part
to
of this
wait
is
till they get
try
to the topic.
you know,
Right.
to standardize how we go
Right.
through all meetings.
And you know, it's really hard because I do participate in a lot of different meetings and I do understand that I take up time, but it is a concern of mine that when I see issues that need to be brought to the board's attention because I don't feel that I have anywhere else to take them, I'm kind of challenged because,
What
you
would be
know.
the other major issue? So I understand that.
Right.
I understand how if they brought up something under other, say, which is always on the agenda.
Okay.
And
Right.
now you didn't have time to comment because the public comments before that. So if there was some modification that would allow, so the rules modified that the public's allowed to readdress if there's something that was not on the warning. So that is one possible. I'm not gonna say it's gonna happen. It's
No,
one possible.
but
So
I've
what
heard
would
that
be the,
suggestion
what's the
before.
second issue that you have?
Well, the issue primarily is where to go with the comment, because a lot of time we're kicked back to we go attend the personnel committee, or go attend the policy committee, or go sit in, and then it's sort of not clear. It may or may not make it to their agenda. It may be an issue that has to follow a different route, but we would not be privy to that, because just like here, the administrative regs are somewhere, and I, as a parent, have no idea what those look like or what it is that's supposed to happen, because all I'm giving them is here's a policy. It doesn't tell me, and especially in recent cases, we've had parents that follow the chain of command. We would prefer to do that, and we have done that. We go to the teacher or the special educator, we go to the supervisor or the principal or the director of special ed or then the superintendent, but then where do you go? And then that's sort of vague, because if the issue still remains and it has not been resolved, and the family is saying, well, this needs to go higher, there's sort of a lack of clarification as to where that needs to go. Every parent feels, well, it's the school board. The school board is the one that sort of hires, they're the ones that are ultimately responsible. So it would be the school board, but maybe that's not the case. Maybe they're supposed to go somewhere else. And to knock on the door, the agency of ed's door every 2 minutes is not a good thing for the residents of Bennington to be doing. or, you know, or the SVSU residents in their entirety. So what, you know, what other pathways are we supposed to take? If the board doesn't want to discuss the issue, the committee doesn't want to discuss the issue, so what do they do with it?
Thinking like constitutionally, okay, you need to run for school board. Seriously, because the board just deals with what it wants to deal with. And the public comments, as I understand them legally, they're rhetorical comments. You're here, we hear what you say, and we may or may not do something about it. So, I think a resolution to the problem doesn't exist because you want a board to do something when a board is not required to do anything. If you bring an issue here that's life-threatening to the students in Pownell, we're all over it, all right? But the board in its wisdom, okay, other people on the board decide whether to go forward with your comment or to table it. So it's, the way the boards are structured is, you have to change the board.
Well, and I'm not asking for the board to actively participate in a discussion. What I'm asking for is direction from either the policy committee or the SVSU board or the administrator, being you, Jim, or someone to provide clarity as to if you have followed this chain and the issue remains unresolved or it continues.
I do think that's something we can
So-
work on, and I'll give you an example. The women who were here this evening on the head lice, I'm the one that told them they need to go to the policy committee. Then I come to the policy committee and I find out
You told them
I
to go
should be writing the
to- that's
regulations.
what,
You know,
it's all his fault.
it's
I-
always
But that's
gonna
what
be-
I'm saying.
And now I've asked them to set up a meeting with me, so we're gonna do that circle. So it's never going to be great, complete clarity. It's never going to be. But we always can work towards making it clear, just like on many of the things that we do. We want parents to understand the
clarity.
process. And we can work on that.
And that's all I'm asking for. I don't want also, if parents are showing up at board meetings and they're putting comments out there, to have an open environment, you know, with fearless communication, because ultimately, how many parents actually show up at the board meetings?
Few.
Not a heck of a lot.
And in my experience,
And
there is-
so if they're making an effort, I think.
But in my experience, the board has been, so far in my short experience, they've been more than generous in the
Right.
time allotment of
Yeah.
the parents. I
I
haven't
have
seen
too,
any
that's why I
parents
don't
shut
wanna
down,
see a
so.
time limit. So, I just wanted to throw it out there, that, just like what you said, Bruce, like not, what are the regs, who knows? And it's sort of, that's how I feel, because, just for example, the same thing happened here with the head lice issue.
This policy that we're discussing on public participation in meetings really only has two, if you could call them exclusions, only two exclusions. That's under item C, which are the ones we just talked about. The policies regarding to public complaints about personnel and those relating to correspondence to the board. That those should follow another policy. So it would seem to me that anything else in this policy as we are revising it could come before the board, certainly anything on the agenda. I'd certainly think that another thing that we might take under advisement is whether we need a policy for discussing appeals of actions related to a particular child or parents made by a board. If there's some way we could clarify that, it might be wise for us to do that, but I don't think this policy would probably be the place where we would discuss how that appeal process would work. This would only deal with the particular meeting and only with those two exclusions. Does that make any sense?
Yes, it does, completely, and that's fine, I understand that. It's just, we've had a lot of confusion with regards to where to go. And, you know, some of these issues are really important, as you saw today. And if they feel that strongly about it, I'd like them to feel, and I'm sure you do too, that they can have and uncork that bottle and say their piece and feel like they're being heard, and then taken in under advisement or whatever and move on. that oftentimes I do see a lot of agenda items being developed at the meeting. Oftentimes the agenda is changed and presented at the meeting. Documents that are shared with the board never make it to the public. There's not enough copies or they're not even posted. So it really limits our ability to, and I'm one that's big into reading, so I really like to stay informed, but it does limit my participation. And then it's voted on and I've had no input or opportunity to review it. And I may or may not have had input, not that it's important, but I'm just saying that a lot of times that's what happens.
One thing I'd like, three things I'd like to say. I never just say one. Hopefully you've been through a number of school boards and committees like this so that I'm seeing you able to address things, and Jim is making his time available to discuss things, so maybe we get some of these things worked through. So hopefully you're seeing that this process, as messy as it is, works. The other thing that this policy does say, 7300, is that it vests power in the chair to have some kind of control over the meeting, and I think that's absolutely essential for that chair to do that. That's a position where you never completely learn what you're supposed to know.
I can appreciate that.
You try to do all the right things at the right time, and it's never the right thing at any of the right times. And
Kind of like being superintendent.
and that was the next thing I was going to say. That when boards have problems, they blame the superintendent, or they shift things toward the superintendent for his or her consideration. And it's democracy, and democracy is just a messy business, and it never evens out. So hopefully we can keep working by talking, but I would guess that if you talk to the chair of any board privately beforehand, during a meeting, anything, and said, I sure would like to comment on this item when it's not first thing as the public comments. I would see it on the agenda, and I want, that's easily done in Woodford, where we have small meetings and several people come to meetings, but.
You probably have the whole population of Woodward that
Well, but the thing
attending
is,
your meetings.
they comment as items come up.
Sure.
And
That's
sort of
fine.
what I wanted to say, and I would be very surprised if documents, as you said, came up at board meetings without being warned, because what I see coming up is changes in consent agendas where they've got a list of names for nominations or resignations, but I don't see documents as such.
I just want to say that half of what you asked for is actually in the section of D, and that is if a citizen wanted to come to the board to discuss something that wasn't on the agenda, that the board may or may not be able to discuss it at that time. But I think you make a great and valid point about the non-agenda items that happen in the other section, that perhaps in the policy there's room, or maybe in a reg, that there is room to include that, because that is a good point.
Where would you put that, or how would you write that?
Well, in section D, lines 52, if questions are directed to school board or credential committee members on topics that have not been posted as agenda items, so that would be from the public to the board, then they could be, the discussion could be deferred, but it doesn't talk about what happens to the other pieces, that a comment from the public may be wanted, which is what I believe you're talking about, Lauren.
Well, yes, it is, but it tends to be with modified agendas that just show up at the meeting, and the addendums or the modified agendas are presented at the meeting. So what's posted online, then all of a sudden someone may bring something, like oftentimes I'll see something requiring financial immediate approval to take action on something. And so it'll show up as a modified agenda after it's been warned differently. And then some additional documentation may be handed out to the board. But it just leads you to wonder, okay, well, what's this, and what is it that they're talking about, and what is it that they're presenting? So it may or may not be listed under other, so it could be,
Somewhere.
it's somewhere. It tends
Well,
to be
these
somewhere.
tend to be, I think what we're getting to now is housekeeping
Yeah.
issues.
So,
You know, I'm hearing I don't like modified agendas, I don't like special meetings. I prefer that meetings are held on the date that they're always held every month, so everybody knows. So, to me, a special meeting has to really be an emergency situation, or we shouldn't be having them for that reason. The same with agendas. The modified agendas that I know that I've had so far under my tenure have been in hiring people last minute, not last minute, but the paperwork comes in after the agendas are mailed out. So the only modified agendas I've handed out at meetings have been to add either a resignation or an additional hire. But your point is well taken. If you're not, those documents should be available to everybody and should be sufficient copies for everybody in the audience, not just the board members. And I can note that and make sure that that does happen. That's easily correctable, so. 'Cause that should be happening. So anything that's handed out at the meeting, that's why my practice always is to be pretty careful about what I hand out at meetings, but we'll make sure that that does happen. Or you can come back to the board and let them know.
I'll just snuggle up to you, Jim, and follow along, that's all.
Do we need to change this policy then, or other than North Bennington's suggestions? Which I think everybody agrees to.
And I think are essentially editorial. I don't think that it would require going all the way back around to the board members, the other boards that have already approved it.
Right.
It's
Well, it's only
essentially
been
editorial.
warned so far, so it still
Oh, it's
has to
actually
go
only-
through a doc.
It hasn't been approved by anybody? Okay.
Yeah, so we're
Well,
good.
Because there's a question about.
doesn't need to be
adding a-
rewarned
a-
either.
a
Right.
statement.
Because as long as it's approved.
So just so I'm clear, so are we saying that public comments, again, are confined to the public comment section unless there's an agenda item that hasn't been posted? Is that what we're saying?
No, the board chair has full
got that
discretion
authority at any
to
time.
open, yeah, absolutely. And it would be my hope that board chairs act that way when it's appropriate. So if there's a new item that comes up that happens to be on the board or if a member of the public has done exactly what, we've suggested to Lori be done, if I have something that I want to bring to the MAU board and I'll talk to Tim early and say, I'd like to talk about that when it comes up, if that's okay. And I think it's perfectly legit for that to happen, but it doesn't have to happen. And it does.
And that's, again, something that, as I meet each month, the week before each board meeting, and plan the agenda with each board chair, if I'm giving a consistent message each time, then maybe we'll start to see some improvement that way. So, call it a cheat sheet or whatever for each board chair, rather than sitting the whole policy out there. Because in the heat of a meeting, it can get confusing, and people don't always make the right decision. So as long as we try to move towards standardization so that everything can be handled the same way, and I think we can work that out as with the policy as written.
So if
With
Lisa can scratch those
Yep, done,
those lines that
done.
you saw and get it to North Bennington's
Yep.
meeting, then we can move on to that.
Yep, all done,
Other comments on that?
ready to go.
Yeah. We have a meeting on Wednesday, so hospital.
I'm sure it is.
She's pretty efficient. 6350, grade advancement, retention, promotion, acceleration. I'm not actually sure what we had to.
It just went out to each board, this one, we just approved it, so.
Oh,
Yeah. So it's just gone out for warning. I don't think there needs to come to this.
I know what the issue was at the SVSU. There was some concern that the background paragraphs didn't jive well with the implementation paragraphs. I think as in the background sort of indicated we'll do lots of different things for different kinds of students. But then in implementation, I think it says we're gonna test, and more tests. That was the message I was getting at the SVSU, I had it right.
So did they give a suggestion?
Both checks were there, I don't know if I got that
make it
really
for
not.
every
That's
word.
all we all liked it. And it went past, right?
Yeah, there was one objection, but it passed. It passed to warn it.
So I don't think we should be doing anything.
We're okay with that for now.
Yeah, absolutely.
Well, the tracking sheet is also included. And what do we want to look at on the next agenda, which is November 3? That's the first Monday in November. Any policies we want to put on the agenda?
I'm still meeting with Tim Payne about the search and seizure, and we have a question into council about some legal issues, so we'll get back to you on that.
That may then.
Yeah, I'll put it down for maybe.
I'd like us to look at, social media, how it's used in schools. I don't know if that would be part of.
Is that part of the telecommunications?
Yeah, it'd be part of one of those.
That would be great.
Others?
Would that be along with the, I mean, I'm wondering about whether we need a separate email policy that also goes, I mean, remember we have all these sort of little separate policies, and I'm wondering whether that makes any sense at all, given that where we are technologically.
I think we already have one.
6140,
Yeah.
telecommunications and network, and 6148, internet use and email use, and 6149. What I'd like to do, if it's okay with the board, with the committee rather, is to look at all of those, update using current language, maybe, I don't know, bring some out, I'd like to work on something that I could bring to the board, to the committee for consideration. Does that make sense?
I'm actually doing sort of the same thing at the CDC. It would be great if we could sort of combine forces on that.
That would be great.
We love it when somebody else writes it for us. Others?
So Frank, you and I will communicate.
Yes, sir.
We have enough to adjourn.
So just one meeting, one policy next time, 6140?
Or there'll be
And,
something.
Well, there'll be
whatever
something
Frank
for
and Bruce and
technology.
search and seizure may be on
Yeah,
there.
I'll see if they-
Wishful.
And other things fall off the trees. And
Yeah.
make time and we can-
Yes.
Really?
Does that work for everybody?
Yes, sir.
Yeah, sure.
Just to go do those things.
Okay, call Frank.
Thank you.
You just adjourned us?
I think you did. Do we have to have a motion?
No.